If you dealt with chronic knee pain, you've probably gone through the frustrating experience of having your pain go up and down on this roller coaster effect, right? Somebody told you to ice and rest the knee and it started to feel better. But then the moment you tried to get active again, maybe train for a competition or a race of some type, and the knee pain flared back up. So what I want to do today is go through a series of 5 exercises that you can start to implement that could potentially pull you out of this frustrating cycle. Check it out. Okay, so with this first exercise, we want to start gaining better access to motion in the knee. And with motion, I'm talking not only about this bending forward and back, you actually need a little bit of rotation through the knee to happen. So we're going to use a foam roller, and we're going to focus on the front of the leg here, the quads, and a little more on the outside of the quad. It's not always the case, but most of the time you have an excessive amount of tension on the outside of the quads that needs to be addressed. So here's what we're going to do. If I'm working on my left leg, I'm going to start with the foam roller right above that bone on the outside of your hip. And what you're going to do is you're going to roll straight down the outside of the hip. It's not going to feel great. Towards the knee. And then as you get right above the knee, you're going to turn yourself, go a little more on the posterior of the leg, the outside hamstring, if you will, and you're going to roll back up towards your sit bone. Turn again, down the outside of the leg, towards the knee. And as you get right above the knee, you're going to turn, apply pressure straight through the posterior of the leg. I would do about a minute, maybe 2 minutes, if it's bearable and not too uncomfortable, on each side, especially the knee pain. Okay, with this next exercise, we want to start facilitating more rotation through that knee. So the way we're going to do this is, you're going to get into a tall kneeling position like this. You're going to start with what they call a negative shin angle. So the shin, step back a little bit, the shin is behind my foot and ankle like this. And then in the exercise, we're going to shift to a positive shin angle. So the knee travels over or ahead of the toes. In combination with that, we're going to do a mobilization. So you're going to take, if I'm working on my left knee, I'm going to take my left hand, I'm going to put it right on the outside of the calf, my palm here, and push forward. I'm going to take my other hand, I'm going to grip my shin bone here. You'll feel a bony protuberance right here on the front of your knee. You're going to grab there, rotate in, shift the knee forward. You're going to relax and you're going to shift back. Push on the outside, grip here, turn in. You're trying to rotate this bone inward as you shift your knee over your toes. One key thing is you want to make sure your heel is not popping up off the ground like that. If you feel your heel coming off the ground, you've gone too far. That's your stopping point. Again, here, rotate in, shift forward, relax, come out of it. Do 3 sets of 12 reps. Okay, so we've improved tissue quality with the foam rolling. We've started to get some rotation through the knee. Now we need to load the knee. And the best place to start, especially if your knee has been really sensitive, is in a seated position like this. You're going to set up a box or a chair or something you can sit on next to a wall, and then you're going to use a physio ball or one of these Bosu balls, whatever they call this thing. You're going to put it against the wall. The pain side, you're going to press the leg against the ball to a comfortable level. So you don't want to overdo this in the beginning. You want to find the edge of pain and hold that intensity of pressure against the ball. And you're going to set a timer. Probably in the beginning 30, 45 seconds. You want to work up to like a minute, maybe even a minute and a half. Several sets. This is an isometric form of exercise, which is really great for chronic pain, managing chronic pain, and beginning to build some of that strength back. Okay, so now that we started to reduce some of the pain in the knee, we started loading it a bit in a seated position. We're going to progress that, and we're going to start loading it from a standing position. And we're going to use a wall squat. So the easiest way to start with this is to start with a shallower squat rather than trying to get parallel. It's a little less stress on the knee if you start higher. And you also want to start with a negative shin angle. I don't know if you remember us talking about that from the knee rotation video, but I'm starting with my feet out in front of me, so my shins are behind the foot and ankle. Find a comfortable position and you press down actively into the floor. As this gets easier, you can drop a little bit, still pressing through the floor. As you get more comfortable with that and you want to progress even further, you start walking the feet in, just like this. Still actively pressing through the floor. Once you get comfortable there, you can progress even more. You can start to even shift your hips into one side. So if you have more pain in the left side and you're trying to strengthen that more, just shift your hips over in the left side, pressing down. It turns into a bit of a single leg wall squat. Give those a shot. I would try to do 4 to 5 sets of about a minute, and you want the last set to be really difficult. Okay, so we come to the last exercise, and we're gonna work on a muscle that's often ignored with respect to knee pain, and this is the hamstring. So the way we're gonna do this is, you're gonna set up a box if you can against a wall, because ideally, you'd be able to set your feet on the box and then your feet against the wall. If you can't do that, find something like a chair where you can just put your heels on the box. But again, ideally, you can have your foot on the box and against the wall like this. Then what you're gonna do is you're gonna press lightly into the wall, about 10%, and you're gonna pull down through your heels. That's most of the force. When you do that, you're gonna lift your pelvis slightly off the ground. Now it's not a full-blown bridge, it's a subtle lift of the pelvis off the ground. You're gonna hold that position, and we've been working on the left side mainly in this video, so in this case, I'm gonna bring my right leg to my chest. You can hold here if you want, and you're just gonna hold this position, pressing down through your heels into the box, a little bit of pressure into the wall, holding that, trying to breathe in and out. Do several sets. I would do 3 to 5 sets of 30, 45-second holds. There can be a ton of reasons why somebody continues to have knee pain. In the video today, we focused on things in and around the knee joint. But if you're not responding to this, you may need a more specific approach where we start to look at things around the knee joint, like the foot and ankle, the hip, even the rib cage. All this stuff can potentially contribute to your knee pain. If you're in this group and you feel like you need more specific help, I'm gonna put a link to a discovery call in the description where we can jump on a short call and figure out if what we do is a good fit. Check it out if you need to.